In this video, I explain the basics of trauma therapy. You will learn what trauma therapy is and how it helps people cope with distressing experiences. Trauma therapy is a form of therapy that deals with the consequences of traumatic experiences. The goal is to help those affected process their experiences. To do this, a variety of techniques and methods are used. The therapy helps to reduce the negative impact on life. A trauma is an experience so distressing that it severely affects a person's psyche. Such experiences can be physical, emotional, or sexual in nature. A trauma can lead to long-term psychological problems such as anxiety or depression. These disorders need to be treated with specialized therapeutic methods. Trauma therapy aims to process memories of the trauma safely and carefully. The therapist helps the patient to view the traumatic experiences within a protected setting. The patient is supported in organizing their feelings and thoughts. The goal is to work through the trauma without the patient becoming overwhelmed. Various methods are applied in trauma therapy, chosen according to the patient's needs. A common method is cognitive behavioral therapy. It helps those affected to recognize and change their thought patterns. EMDR, eye movement desensitization and reprocessing, is also often used to process traumatic memories. During therapy, the patient talks about their experiences and feelings, while the therapist provides empathetic support. The therapist helps the patient recognize negative thought patterns and develop new, healthier ones. The conversations are meant to help the patient gain better control over their emotions. Often, several sessions are needed to make progress. The main goal of trauma therapy is to help the patient cope better with the effects of trauma. Another goal is to improve the patient's quality of life. This is achieved by processing distressing memories and reducing symptoms. In the end, the patient should be able to live a normal, fulfilling life again. Trauma therapy can be helpful for people who have experienced severe events. These can include victims of accidents, abuse, or violence. People suffering from post-traumatic stress disorder, PTSD, can also benefit from therapy. Therapy is especially important when distressing experiences affect daily life. The duration of trauma therapy depends on the severity of the trauma and the patient's individual progress. Usually, therapy lasts several weeks to months. Some people may require longer support, especially if the trauma is very profound. The therapist decides together with the patient how long the therapy will continue. Trauma therapy helps those affected process their traumatic experiences and reduce the effects on their lives. They can learn to handle their fears and other negative emotions. This enables them to have a more positive outlook on life again. The therapy contributes to improving quality of life in the long term.